Hey guys, Rick from the Motivated Paramedic. I want to talk about some medicines that probably almost all of us have on the ambulance. That's normally calcium chloride and sodium bicarbonate, 8.4%. This is 10% calcium chloride, only a gram. I've been doing this a long time, and almost every ambulance I've been on has some form of two of these medicines. Now, the funny thing about these medicines, we normally give them in cardiac arrest. We normally give them together, especially with our renal patients that we suspect hyperkalemic states, and we're trying to address them. Now, there's a lot of literature that says maybe bicarb doesn't do as much as we think it does addressing hyperkalemia, and calcium is more for helping the heart not go into an arrhythmia or help kind of protect it. But they are given a lot together. So I wanted to show what can happen when you put these together. I drew up 10 cc's of 8.4% sodium bicarb. I have it in this glass. As you can tell, it's clear. There's nothing in there except that. And then I have calcium chloride. I'm going to just put 5 cc's. You'll see it's clear. And when I put 5 cc's in, almost immediately you get this white milky solution. I'll leave this out and we'll set it to the side, and we'll talk about how it'll dry up in a little while and it'll almost look like a salt-like substance. Not all the time, not salt itself, but it's getting thicker and thicker, and I'll take some more pictures and put them on the post as well. But when we think about giving these medicines, again, very commonly given in cardiac arrest, we should think about, are we flushing that line effectively? Is it an IO? Is it two peripheral lines? Is it the only line we have? We want to make sure we're putting a couple 10 cc to 20 cc flush in between both the calcium and the bicarb, because otherwise we get this very white, milky, salt looking. And then imagine if you were to put that, I'm going to draw some up in the syringe so you can see it. And that's what you end up with, this white, milky fluid now inside of their veins. And precipitation, obviously the color change, but it's also thickening. And now we're going to have this inside of their veins during a cardiac arrest, which is never good to have at any time, but during a arrest, I think it would be even worse. Have a great day. And if you haven't followed me, please do, and share this with anyone that you think might like it. Have a good day.